data can be collected to really help us understand the disparities, the inequalities, the risk factors that put individuals and populations at a higher risk of severe disease and or death. And there's ways to do that through surveillance data, through the routine collection of information that we have from people who are detected through routine surveillance systems. We also have the opportunity to do different types of studies, so research studies that either focus on hospitalized patients and looking at people who show up for health care, who are detected through health care, through other types of investigations and epidemiologic studies that focus on different types of populations to really help us identify the extent of infection among people, which is either measured through these molecular tests or PCR tests or serology, which measures antibodies, and those risk factors of why certain people are getting infected and what are those risk factors that put them at a greater risk. They can also evaluate not only those types of characteristics, but health-seeking behavior, access to health care, looking at underlying conditions. I think this is a very complicated story that really needs good information to be able to help us disentangle this. But I think what is most critical for me anyway is that we have to do everything that we can while we're learning. We have to do everything that we can to prevent as many infections as we can. And we do have the tools right now to do that, and we need to be focusing on that. Because not only do we prevent infection from people who may have an asymptomatic infection or a mild infection, we prevent them from passing the virus to somebody who is part of that vulnerable category and could go on to develop severe disease and die. So there's a lot of ways that we can do this through surveillance activities, through routine data collection, but also through specific studies that can happen across many different countries.
All right, Mayor, thank you for your question. Yes, I'm sorry, go ahead.
If I could just briefly supplement, because I think that it's a very important point, and I think there is more research needed in this area. There's lots of anecdotal measurement going on, and it's very important, and it's pointing to some of these deep inequities, be they socio-cultural or be they ethnic. But there is no question that these factors are particularly driving negative outcomes amongst many, many groups. And we need to document this much more carefully, much more systematically. We've been using the Director General created a Solidarity Fund a number of months ago, and we've been trying to use and identify interesting projects that are maybe not subject to the normal mainstream funding, and we will certainly, based on your advice, look more systematically at how we can fund studies around the world on this particular theme. And while I have the floor, Atlanta hosts one of the greatest scientific institutions on this planet, the Centre for Disease Control. And as the DG spoke about ongoing work, I would again like to thank the United States for so many decades of service of the Centre for Disease Control all around the world. I don't know if Americans realize just how important CDC is, not just to Americans, but to every citizen on this planet. We have worked hand in hand for many years. I have learned at the knee of so many great scientists at CDC. So it's just great to have the Mayor of Atlanta on so we can say thank you for hosting such a wonderful institution, and our regards to all our colleagues and friends over there. The politics of these things will never shake the bonds that scientists have around the world and the urge and the desire we have to work together to save lives.